So a lot of our patients are actually coming to us for help with sleep apnea. And sleep apnea is a condition where patients are not able to get the rest and the sleep that they need. Patients are not able to get and there's several conditions. One specifically that we can help with in dentistry is obstructive sleep apnea. And obstructive sleep apnea is where the patient's soft tissue, such as their tongue, closes the airway space in the middle of the night. Hence, this is why they snore. So it's the vibration of that tissue in the back of their throat that we always call snoring, but the reality is that that's a form of obstructive sleep apnea. So patients actually aren't getting the oxygen levels that they're supposed to maintain throughout their sleep. They're not actually able to fulfill that cycle of sleep to get the restful sleep that they need. And they suffer during the next day where they may wake up with headaches, they feel drowsy in the middle of the day, they're constantly drinking coffee to offset their tiredness and lack of rest. Well, as dentists, we have the ability to actually help. We work with a team of sleep physicians here in Central Ohio who obviously help us to diagnose the patient's condition and treat the patient through non-invasive methods, so non-surgically. And those include certainly CPAP, which a lot of our patients have heard about, certainly the gold standard of how we treat severe sleep apnea. But those that are not able to wear the CPAP or unwilling to wear the CPAP can often benefit from an appliance. And at Infinite Smiles, what we do is we make a digital appliance. So everything's scanned in the 3D image so we can actually see the patient's skull. We can actually position the patient virtually in a position where we know it's going to open up their airway space. And then we can make an appliance through CAD/CAM process where it fits perfectly in their mouth. It's very comfortable to wear because it's designed to be thin in nature, and it holds the patient's jaw forward, but it's calculated. So because of the 3D imaging and the virtual opportunity for us to position the patient, we know exactly how much it's going to open up their airway. So our patients leave sleeping like babies. And it's an eye-opener for a lot of our patients. It changes their life. In fact, it changes their spouse's life too. You know, one of the biggest complaints that we get is not necessarily from the patient who actually suffers from the sleep apnea, but it's their spouse. Because their spouse can't get the rest that they need because their bed partner is snoring so loudly and disturbing the sleep patterns of everyone else around them. So it's often the wife who sends in their husband that needs to have sleep apnea treatment. And that's one of the beauties of working at Infinite Smiles.